Hello Empire! For this week's video on the OV calls and success, positive and negatives that came out of a cold call, I'm going to discuss Dr. Yadigar, a physician, pain management physician who's part of Orland and Cohen's practice here on Long Island. I went up to Dr. Yadigar in regards to talking about PRP because I had heard that he's interested in using PRP for facet joint pain. Currently he's using other injections under the fluoroscopy. So I had initially gone up to him, presented him information on our machine, the indications, and how we felt that PRP can be used in his practices. From there, I had set up an appointment to come into his office, sit down with him, and discuss how we can implement the PRP into his practice. Prior to leaving his office, I had asked him what his take on hyaluronic acid injections was, and if he's currently using anything in his practice. He told me that he isn't currently using anything and that he refers out those patients to the other side of the practice, the sports medicine, total joints, and more rehabilitation therapies are done within his practice. So we just further discussed Orthovisc and how he can bring that to his practice as well and see great benefits, successes, and also use it as more of a target for his end on getting patients into his office. Rather than referring out these patients, he can start treating them with our product. So for me, I am going to be dropping off more information this week in regards to OV. He's not completely content on how he feels about going about these injections. He doesn't feel comfortable quite yet, so it's going to be progress that's going to be worked on, and rather than pushing the OV completely quite yet, I've really pushed the PRP on him, and he's going to be hopefully starting in this week, the next week, using the PRP injection for more of his facet joint pain patients. And I'm going to hone in on the OV and how it can be implemented into his practice as well. So for me, that seemed to be a great success as for PRP coupled with the OV, and really building the relationship rather than just walking out of the office and not having much more to bring to the table other than OV or PRP. He sees that it's something that can be implemented in practice and be beneficial to him and other physicians within the pain management side of Orland and Cohen as well. So for me, I will be letting you guys know what happens from here, and I look forward to hearing about your successes with the OV calls as well. Thank you.